Hello everyone, welcome back again to MGI channel. It is very common for most of us to experience abdominal cramps and diarrhea after drinking cold beverages or bloated stomach and constantly farting after a meal, constantly having the urge to run to the toilet when you are nervous, or diarrhea after eating spicy food. It is so common that many pay very little attention or no attention to these symptoms, thinking that it is a norm. Little do we know that these symptoms could be due to a functional gastrointestinal disease known as Irritable Bowel Syndrome, or in short, IBS. In today's video, we are going to learn more about IBS. Functional GI disorders, which doctors now call disorders of gut and brain interactions, are related to problems with how your brain and your gut work together. IBS causes abdominal discomfort or pain, which is associated with altered bowel habits with the absence of organic disease. IBS does not reveal any abnormalities along the gastrointestinal tract with an endoscopy, unlike other GI disorders such as celiac disease, Crohn's disease, or colitis. There are three main types of IBS based on different patterns of changes in bowel movement. First would be the diarrhea predominant IBS, in which loose stools is presented more than 25% of the time and hard stools less than 25% of the time. Second would be the constipation predominant IBS, in which loose stools is presented less than 25% of the time and hard stools more than 25% of the time. And the third type would be the mixed presentation IBS with alternating diarrhea and constipation, in which loose stools is presented more than 25% of the time and hard stools more than 25% of the time. Irritable bowel syndrome is a complex, long-standing illness which is often difficult to diagnose and exhausting to live with. There is no best treatment for IBS. You may have to try a few treatments to see what works best to treat it. Doctors may suggest changes to be done in your diet and other lifestyle changes. Some dietary changes that may be done includes: first, increasing fiber in your diet by eating more fruits, vegetables, whole grains and nuts, or you may add fiber supplements to your diet. Second is to include probiotics. Third is to drink plenty of water. Fourth is to limit caffeine intake. And fifth is to have a food diary in which you can record the foods that you have taken so you can figure out which foods trigger your IBS flare-ups. And last, you can also follow a special diet called the low FODMAP diet. FODMAP stands for fermentable oligo, di and monosaccharides and polyols. These are a group of non-digestible short-chain carbohydrates which your gut would ferment them and cause an increase in gas as well as short-chain fatty acid production. Consequently, FODMAP triggers digestive symptoms such as bloating, gas, stomach pain, and altered bowel habits varying from constipation to diarrhea or a combination of both. Other lifestyle changes which can be done to help with IBS are, for example, increasing your physical activity, reducing stressful life situations as much as possible, or try relaxation techniques such as deep breathing, aromatherapy, or a good massage. Your doctor may also recommend certain medications to relieve your IBS symptoms if you have tried diet and lifestyle changes but nothing seems to be improving. That's all I have to share for today. Do click on the like and subscribe button to learn more health tips with us. See you!